DPM services are the locally relevant dog population management interventions and activities that encourage and support positive human behaviors and provide a safety net for unmanaged dogs in a community. Some are essential services. They are critical for effective DPM systems in all communities. Other services are context-dependent. They are not always essential but become important at certain times and in particular contexts. Let's use our dynamics diagram to explore how different DPM services make an impact. Promoting responsible behavior. These activities target the humans that most influence DPM, including dog owners, carers, and people living alongside dogs in the community. Impact. All processes, and all types of dogs. Strengthening DPM professional capacity. These services provide vets, animal welfare workers and other professionals with the training, mentoring, and support they need to be an effective part of a DPM intervention. Impact. Breeding processes in all dog subpopulations. Relinquishment and abandonment of owned dogs. Removal to, or adoption from rehoming centers. Reproduction control. These services include sterilization of owned dogs, and sterilization of community-owned and unowned dogs through CNVR, catch, neuter, vaccinate, return. Effective when targeted for the right dogs to prevent unwanted litters. Impact. Controls breeding in all dog subpopulations. Reduces abandonment or relinquishment driven by unwanted litters. Community engagement is a critical process for effective CNVR programs. Veterinary care. Provides basic health care for dogs, including preventative care, such as vaccination and deworming, to promote good dog health and reduce the risk of zoonotic disease. Impact. Reduces abandonment or relinquishment by owners unable to manage dogs' health. Community engagement is important for delivering vaccination. Rabies vaccination makes removal, or culling, unnecessary. Formal education of children. These are programs taught by professional educators for children, focused on safety around dogs and good dog care. Impact. May influence processes related to dog ownership when children have influence over dog care at home or as they become dog owners themselves in adulthood. Holding facilities and rehoming. These facilities are not the same as sanctuaries. Instead, they are designed for short-term accommodation for disease quarantine, reuniting dogs with owners, or rehoming through adoption. Impact. Support reuniting, especially when coupled with ID and registration. Provide option to relinquish unwanted dogs rather than abandonment to the street. Provide adoption as alternative to purchase. Identification and registration. Refer to national registration systems, including the capacity to read microchips, check matches in the registration database, and contact owners. Impact. Reuniting lost dogs. Supports identification of owners related to dog abandonment and roaming. Influences purchasing by supporting breeder and seller regulations. Control of commercial breeding and sale. Implemented through both legislation and enforcement, controls are supported through public education by governments, vets, breeding associations or clubs, and NGOs. Impact. Controls dog purchasing. Can reduce abandonment and relinquishment of unhealthy or unsocialized dogs. Supports reunification if first identification is the responsibility of the breeder. May make adoption a more attractive alternative. Managing access to food resources. In areas of high human-dog conflict, such as public parks or hospitals, animal-proof bins and localized feeding bans are used to avoid attracting free-roaming dogs. Impact: can reduce the need to remove dogs. For owned roaming dogs, can reduce the motivation to roam to access food. Here's a quick recap. When well chosen and properly implemented, DPM services can meaningfully influence dog population dynamics. However, no single set of services will suit every context. You should select the services that address the priority problems and processes, identified through assessment, targeting the right dogs and people accordingly. The strategic focus and activities will differ between locations and evolve over time in response to local conditions and needs.